my little story about Gwyneth happened in the year 2000, and it was somewhere in Victoria, BC. And this is the first time that I was meeting not only Gwyneth, but I was also meeting Sandy Timchuk, another great in the field. And I think I had met Maurice once before, and Maurice was my thesis supervisor. And we're in a little restaurant, and I'm not talking. I'm not saying one word. And Gwyneth was the one who kept coming and asking me direct questions just to make sure that I was comfortable, because she had understood that I was just completely starstruck, and that it really affected how I was able to relate to these people that I had read about or read their work in the last few months. So it is your kindness, Gwyneth, that touched me the most through these years. And I have many other stories, but they're all about how kind you are and how wonderful you are as a human being. So the fact that you're a great scholar on top of it is just bonus, but you're just a wonderful person. And I'm so thrilled to have you with me today for this conversation. So thank you.
Thank you, Marjorie. And it must be true that people who know each other well and really like each other remember similar things, because my story is also of that little restaurant, I think down at the harbour front in Victoria on Vancouver Island, I guess in the year 2000. And I can remember Marjorie sitting there and saying nothing. And yet when she did speak, what she said was profound. And I encouraged her, I guess, as she said, through very direct questions, which is a lifetime of what I've done. But it was more than that. It wasn't just what she said was profound. I realized then, and actually over the next couple of years, that Marjorie has deep respect. And that's what warmed me to her thoughts and her views about working with parents with intellectual disability. Now, sometimes, and this is my story, her deep respect is totally misplaced. There's no doubt about that, because one of my memories of that time, and later in Seattle and in many other places where we've met, it took a long time before Marjorie would call me Gwyneth. She always called me Professor Llewellyn or Professor, and that was just so weird. Of course, it's a cultural difference, because in Australia it is really, really extremely uncommon for anyone to call their professor. But it's also, and of course it was funny, but it's also indicative, I think, of Marjorie's deep respect for others. And that's come through in all the work that she's done with parents with intellectual disability and other developmental disabilities over the years. And it's why I value her friendship as well as her collegiality, and as well as her as a critical scholar in this area.
Thank you so much, Gwyneth. And I have to say that I had a backup story just in case the first one didn't feel right. And my backup story is about how I was just appalled at knowing that your students called you GL. And I was like, what? How are you calling her? Yes. So it's really funny because we're talking about the same things. Yes.
And the same students who now, of course, many of them are professors, they still call me GL. Nothing has changed.
Yes. But that proves to me, you know, for sure it's a cultural thing, but I think it's also sort of, you know, you knowing that the title doesn't make the person. And it's really what
No.
what I was trying to say at the beginning with my story is that, you know, you don't need a title. You're a person that's just you know, impresses, but also, you know, through your kindness, you are able to touch a lot of people, and that's pretty amazing in it of itself. So it's fabulous. If we start from the beginning, so I got in where, you know, yourself, Sandy Timchuk, Maurice Feldman, Tim and Wendy Booth, you were already sort of in the field, but I don't really know how the field started. So maybe you could help us in terms of understanding what led you to the field working with parents with intellectual disabilities, and your input in terms of making the field what it is today.
So where I started with parents with intellectual disability, it's a long time ago, but I can remember the moment because I was a very young lecturer, very inexperienced lecturer who'd worked in the field of developmental disability and had come to work in the university. I'd been there probably only maybe 3-4 years, something like that. And this particular morning, there was a phone call. And it was a phone call from a woman at what we then called a developmental disability service. And this woman called me and she said, Gwynnyth, I know of your work in developmental disability, and we just have something that's happened and we don't know where to turn. So we thought we'd ask you. She said, we've just met a young woman with quite a moderate to severe intellectual disability, and she's pregnant. And we just have no idea what to do. And I was taken aback because I'd not thought, this is way back in the 1980s, I'd not thought about women with intellectual disability becoming mothers. I wasn't shocked. I wasn't dismayed. I was simply taken aback because it was something that wasn't in my sort of worldview, as it wasn't in their worldview. And they were people, clinicians, who worked with people with developmental disabilities in a community-based team. And this woman, she had arrived literally on their doorstep. They'd never met her before. She never lived in institutional care, which is where most of the people that they knew had lived in their younger days. This lady, she just turned up with her mother, and her mother saying, I think we might need some help because my daughter, who at that stage was just on 30, is pregnant. So from then on, that's been the rest of my focus since that one phone call. Sure, there's been other things. I've done work with children with disability, particularly around violence and abuse and neglect, and other areas too. But that one phone call and that mother, her mother, and then her little baby boy, born very ill and quite prematurely, a central feature of my life, both as a person and as a scholar.
Wow, I love that story. And I think that, you know, I know many who have a similar story of that one person who just like, or that phone call, basically, that just, you know, guides you to a different path than you would have even imagined. So I love that story because it makes it very personal and makes it very, human also at the same time, because even though you've been working in this field for so long, you too at the beginning didn't even like consider that might be the case. And I find that that's also very relatable. Yeah. So that's how it got you into the research world. There's also something that's very important to the both of us, which is the Parenting and Parents with Intellectual Disabilities Special Interest Research Group from the IACID. And I know you had a say or definitely sort of started that special interest research group. So I wanted to ask you how did that start, basically, and where did that idea come?
So the way we started the special interest group for parents with intellectual disability in IACID, it was one of those, I suppose, circumstantial events. After I'd met the mother that I spoke of, I spent a lot of time trying to understand, do other people know about this? Is this something that I'm outside a world, that there's a whole world of knowledge out there and I've just never entered it. So, and it is quite a long time ago. So people actually wrote letters then. The internet was not as it is today. Yes, we could communicate, but it was primarily more through mainframe computers and a particular internet that was available only to universities. So it was rare to do so. I wrote an article, had it published. I think it's called Professional Perspectives or something like that on parents with intellectual disability, because I read everything I could and wrote about it. And a letter arrived for me to that same office in that same building from Tim Booth. And he and his colleague and wife, his partner, Wendy, were also doing what I'd started doing 12,000 miles away in the UK. They were working with a group of mothers and really trying to understand their stories and find out what would support them to be able to live lives that were less discriminated against, more fulfilling in their local community. And by the time I got this letter from Tim, I was also doing the same with the same mother and a group of other mothers in the local community near the university campus. And we were having groups, designing a parenting game called Safe Parenting that the parents could play with each other to actually learn some things which just through circumstances they had not been able to learn prior to becoming a parent. So Tim and I and others such as Sandy Timchuk, who you mentioned, and Maurice Feldman, we became colleagues in those early days. There were several others, some from Europe, some from Scandinavia, but I guess the core group was Sandy, Maurice, Tim and Wendy and myself. And on a visit, Australians travel prodigiously because we live so far from anybody else. And for many years, people felt it was too far to come to Australia. So we all moved. I visited everybody. I spent as much time with them as I could for as long as they were prepared to tolerate me asking questions. And on a walk on a lovely winter's day in the UK, Tim and I said, literally almost at the same time, overlooking a reservoir, ducks floating on the surface, we need a special interest group. We have to do something to change the way this large scientific community that is committed to people with intellectual disability, we need to change the way they think. And that's why we called it, in its early days, its first iteration, Parents and Parenting with Intellectual Disability, because our focus was on the parents. Respect first for the parents, and then thinking about their parenting. So we purposely framed it as about people rather than deficit, because at the time, the literature was primarily about deficit. It was primarily about these parents cannot be or are not adequate or good enough parents. What should be done? Rather than these are people who have become parents, and what do parents need to be able to parent successfully? So we started from that sociological base rather than from a clinical or intervention base. So that was the beginning of the special interest group.
That's amazing. And one thing that that's striking to me is how you said you traveled and met like everyone and just like, you know, like wanted to know more, wanted to connect. Because there's also another sort of memory of you. To me, it was like shortly after our meeting, you had said to me, there's the conference that's coming up soon in like August. My students are going. You should, you know, rent the same room as them and sort of like hang out with them.
Yes.
And I think you had sort of guessed, you know, that I too wanted to know more and I needed to connect. And I was the alone student from Canada, pretty much isolated in a field where you feel like you need to have, you know, partners and friends because you face sort of those disparities with these parents. You know, I was going to say mothers, but parents. Because a lot of the time we have to defend, we have to advocate, and we have to sort of showcase and remind people of the strength, remind people that there are people first. And so that was very interesting for me to hear you share that story with us. So I guess that would be a good segue in terms of looking at some of the articles that you chose for today. And the first one is actually on social support. And I found that very fascinated because I remember that at the time, everything was very parent training focused. And I felt like when you published this paper, you were putting the focus on something else that was just, you know, different than just looking at it through a clinical eye. So do you want to tell us about that paper and research around it?
Sure. And Marjorie, I'm horrified that you don't remember that I'd already published several papers about social support before this one. But you're right. My doctorate, in my doctorate, I purposely chose to understand in depth the lives of parents, because there was dad there as well, with intellectual disability, to try to, as best I could, clearly not being a parent with a disability, and particularly an intellectual disability, to understand their lives from their point of view. And one of the aspects of their lives that was clearly critically important was social support. And my friendship and my colleague then too, Tim Booth, he and I talked about this a lot, because both of us had begun by really saying, what is happening in these parents' lives, and what is it that may make their lives a little easier, if I can put it like that. And I'd learned from designing this game, Safe Parenting, and the parents playing this game in a supported environment, in a family community centre, 1 day a week, and how much it meant to them, the actual support of being with each other, as well as in that supportive environment, so much so that one of the mothers actually had to go to hospital for a few days. The other parent said, well, we're still going to play. And they all turned up in the local hospital in the general medical ward. And there was a furore from the staff saying, you can't do this. And they said, well, she's coming back to the centre with us if we're not allowed to stay. And the game was a board game. They sat with the board game on her bed and played together. This teaches us as scholars, what is it that matters in people's lives? These are the circumstances that we need to pay attention to. What is it that matters to people? What is it that helps them feel fulfilled? So that's why social support became, for me, a focus. I was not so interested at all in what seemed to me to be a little bit of a blame game, a defect finding game. It didn't suit my view of the world. My view of the world is very optimistic, knowing that everybody, given an opportunity, can blossom. And so I focused on social support. What was really critical about that paper is that it was published in a journal, a high-ranking journal, which is important because other scholars read that. It may not be so important to practitioners or child welfare professionals, but it's important for scholars, and it's important for two reasons. It spreads the knowledge to other people, and other people then start to think maybe there is something worth doing here. But it also spreads the knowledge that helps to get funding to continue developing that knowledge. So the article was important for many reasons, not least that we were able, because it was a larger sample of mothers, they weren't all from what we would call a clinical population. They were mothers, including all the ones I knew from the Safe Parenting game days, who lived in the community. They weren't deinstitutionalised people with intellectual disability, but some of them had really quite severe difficulties. So I needed to understand that too. How had they managed to keep going in the face of discrimination and people thinking they couldn't possibly be parents? And that study opened many people's eyes to it, because we came to understand that if you're a single parent, life was going to be more difficult. Sure, you might get support from services, developmental disability services or family services, but your network, as it were, was going to be primarily professionals. And good as professionals are, they're not friends. They're not someone who you can just have a laugh with, go out and socialize with, talk nonsense with, sit and watch telly with. They're professionals and they move on. That if you lived with a partner, you were likely to have quite a broad network of support, both from your own family, the family of the partner probably, as well as yourself for the mother, and a dispersed network, because there would be other people in those families who would also support you, but they may not be geographically close to you. And then the third group was the mothers who actually still lived with their parents. So they never left the family home. And often the grandmother was doing some of the raising of the child or children. And those mothers were very alone. Sure, they had good support from, say, their mother and the mother or father or brothers and sisters, but they didn't, again, have peers or friends or someone just to hang out with, share the stories of being a mother or a father together. So to me, it was a critical moment when we published that paper, and literally people came out of the woodwork from then on to share their stories of other people they knew, other mothers, other fathers, and how they were living their lives. It did open a floodgate of interest in the lives of parents with intellectual disability.
I love this conversation because you are making me see this paper in a totally different light. When it's something that, you know, I had read a few times before, that I reread recently in preparation for today. So I just love this. This is like amazing. Thank you for those stories. I love that. The next paper that you submitted to me was about home safety. So do you want to tell us a little bit about that one?
Yeah, well, this one was, I'm not sure I know exactly how one would say this in the Australian culture, how it will translate to a North American or a European or any other culture, I wonder. But Margie, maybe you can help me out here. But this was my attempt with my colleague, David McConnell, who had also been an author on the previous paper on social support. This was my attempt to say, if we really want to continue this whole line of interventions to support parents, typically mothers, but also parents, fathers too, with intellectual disability, we better do it in a way that we know it actually works. Now, that's provocative because, of course, we had by then quite a body of knowledge from people who I call my colleagues, and I hope they would also see me as a friend, Sandy Timchuk and Maurice Feldman. But most of that research was either single case study or with smaller groups of parents who came from clinical situations. So they're parents who are already identified as having such a difficulty that they're in a service setting. And I felt strongly for many years that we needed to broaden our interest to understand better about all parents with disabilities, including parents with intellectual disabilities, in the context within which they live. So the continuing and continuous theme through everything that I've done is about context. Understand the context. Understand, if you like, the ecology. Understand what's in the environment. Because if you can open your eyes and really look and listen to what is local, then you have a much better understanding of why people act in the way that they do. So we needed to use a design where we could randomize the parents to the intervention. They weren't parents only from clinical services. They were parents who were living in the community, who people said they may benefit and they're interested to do it. And that might have come from a family member, or it might have come from a church group. It did not, these parents did not necessarily come from a clinical service. And a randomized control trial allows you, it's called the gold standard of interventions, typically used, of course, for things like pharmaceuticals and so on, but perfectly possible to do in what we might think of as a more social setting, because of the way that you randomize how people begin the intervention and where you take the data points. So that was the first randomized trial to be published anywhere in the international literature about interventions for parents with intellectual disability. And I'm forever grateful to Sandy Timchuk for being very open and sharing with the program that he developed at the University of California at Los Angeles. We adapted that for the Australian situation. And I'm very grateful to Maurice Feldman for everything that he taught me about all of the interventions that he'd been using at that stage in what was then a quite clinical setting in the Surrey Place Centre in Toronto. So all of that knowledge and their support brought that randomized control trial into being. And that's what we did, developing the materials for both the home and safety components of parenting for parents with young children.
It's funny because I had, in the notes that I took, I had underlined randomized controlled trial because I wanted you to talk about it. And I find that it's great that you're actually within the story of why you chose this piece, that you actually talked about it. So maybe my next question is a little bit for the researchers in the field, the new researchers, the new career researchers. You know, that must have been quite a challenge to have. I think you had, oh, I forget how many parents you had, 45 parents for this group that were not in clinical services, as you mentioned. How did you do that? Because that is really hard to do, to identify parents.
Yes, it is. It is hard, but maybe I like hard. I like obstacles. It's hard. It's hard if you come from a clinical setting. It's hard if you think of these parents as belonging to clinical settings. It's hard if you think of people with disabilities as primarily a clinical population. If you think of people with disabilities just generally as your next door neighbour, your, in my case, brother, in my case, also an uncle, if you think of people with disability as people in the community, because disability is all around us, then it's much easier. If you think about people with disability, and including mothers or fathers with intellectual disability, as only being found in clinical settings, of course it'll be hard. Mm-hmm. But there's lots of ways to do this. And there's just lots of ways. I don't know if this is common in other countries, but in Australia, general practice, or what's called family medicine in North America, is basically a free service with a nationalised health system. Everybody is eligible for what's called Medicare and can go along to what we call general practice, or in North America you might call family medicine. And people sit in waiting rooms, and on the wall of the waiting room you literally put up a notice and you have little tags on the bottom of the notice with the telephone number and who to call. And of course, in later iterations, also email addresses or websites. People, what else do you do apart from watch television or read a magazine when you're sitting in the waiting room? So we have recruited many, many times using that sort of facility. We've also recruited by having toll-free numbers that people can call. We've worked our networks, particularly at the community level, where we used to have things called community newspapers, and journalists would write stories, and they'd be human interest stories. So, of course, people would read those. And it was never about dobbing parents in. It was simply about, if you know someone who you think would enjoy doing this, then let them know. And if they're interested, they can contact us, because ethically, we couldn't go out and ask people, would they join our research projects? It had to be through a third party. And that's how we did it.
Wow. Easy. But you're right.
Easy.
It's exactly. We just have to put a different kind of lens. And I think that that's the message I will take away from that story. That definitely, the way that we see people and where they go and they hang out, this is where you can reach them and reach, how many you need to reach. So it's a great message, definitely. Okay, so there's two other, an article and a book chapter that you talked or you sent me. For me, you'll tell us why you picked them, but for me it was interesting because one of them was really to look at how parents with intellectual disabilities sort of compare with other parents, and taking in pretty much all the larger data sets, studies that were written up until then. And then your book chapter, to me, has a little personal connotation, just because I became paraplegic 10 years ago. So I had already been in the field for a long time. I was mom to 16 months old Thomas. And so all of a sudden I became a mom with a spinal cord injury. And, as I'm going through my process, you, in terms of your research interests, started to bring in different population of parents with different disabilities. And that's what that chapter is about. So could you tell us more in terms of why you chose those two, and if you have stories about them, that would be awesome.
So around, I think it would have been mid-1990s, I'd been doing a lot of advocating about parents with intellectual disability. And I thought totally inaccurately that the research that we'd done demonstrating that so much of their lives were circumstances beyond their control. Much of it was due to social structures, to inequities in the system, or inequalities in the system, which created inequities for these parents. And I had thought that knowledge that these difficulties were what was critical in the lives of parents with disabilities, but particularly for parents, or in a very specific way for parents with intellectual disability, that knowledge would open people's eyes. And I'd come to realize that knowledge isn't enough, that knowledge of people's circumstances by itself isn't enough. And my colleague Eric Emerson in the UK had come to the same conclusion, not about parents with intellectual disability, but about intellectual disability per se. That the stigma and the discrimination, the stereotypes, the assumptions about people with intellectual disability was so strongly rooted in our cultures that it was hard for people to believe when people did well, when they succeeded in life, when they, in my case, they were parents and managing very well. We needed a different way. And I've always been taken by two particular sayings. One, you can trace back to Mark Gold, who was very early American psychologist working with people with intellectual disability. He developed a whole system of support, and it was called Try Another Way. Simply think differently, try another way. The second is about what's often called divergent thinking and convergent thinking. In convergent thinking, you can continue to dig the hole in the same place, but you're actually not digging much deeper or learning much more. Divergent thinking says, go dig the hole in another place. So Eric and I together started digging the hole in another place, trying another way. So, and I pay absolute tribute to his skills to think at a very high level in statistical analysis to do this. That is not my strength. My strength is being able to think divergently and think differently about the situation. So together, we started looking at what are the lives of parents with intellectual disability? How do they look when you compare them to the lives of parents living in similar neighborhoods with similar other things happening in their lives? How do they look? Are they the same? Are they different? Is their parenting any different? Do their children do as well or better or worse? And asking that in relation to parents without disabilities, and then later asking that in relation to parents with other disabilities. So that allowed us to start to see what is it that is happening again in the ecology, in the lives of this particular group of parents, that means that there are circumstances that people become concerned about. Because that's really why we're talking today, because people are concerned about parents with intellectual disability and in particular their children. So that's what we started doing. So I think it was, we started that in the late 90s, and we continue to do it not only with parents with intellectual disability, but with children and young people with disability in low and middle income countries right around the world. So we have lots of publications which try to understand ecology and context. Why is it that it is so, is the question we're asking. Why do their lives look different? How different are they? And what can we do about it? And the reason that we ask what we can do about this, when their lives are different, they are more disadvantaged, they are more discriminated against, it is more likely for parents with intellectual disability to have a lower education level, live in unsafe neighborhoods, less, not only economic resources, financial resources, but less social resources as well. And often to have mental health difficulties through the stressful environments in which they live. So all of those things together, all are amenable to change. So if we can understand the extent of the difficulties in the environments of parents with intellectual disability, we can begin to envisage a different outcome. We can begin to envisage what is it that needs to be done to change these contexts so people have access. These, what are social inequalities? What is it that needs to be done so that we can change these contexts so these parents have the best start too? Not just parents who live in very safe and very nice neighborhoods, not just parents who have access to lots of resources. How is it everybody gets a fair go? So that's the beginning of how we started all of our studies on what are really comparative population studies. They require that there are large data sets, which means it's either the whole population. Think, for example, of a census. All countries run a census. And in that census, if the data is collected on disability, you can compare the lives of people with disabilities to the lives of people without disabilities. Think also of administrative data, child protection data. That's very large data sets of child protection data on parents, on their children, on out-of-home care, on all of the orders. Again, for parents with intellectual disability compared to parents without intellectual disability. So that 2015, I think it is, paper, we took all of the literature then, which had focused on using these large data sets and comparisons between parents with and without intellectual disability. And again, that paper had quite an impact in, again, people coming out of the woodwork and saying, I think we can do this with data sets that we have in our country. And we would then better understand how, for example, there was very little research using those sort of data sets in the US at that time. So now we have a very big group of people interested to use all sorts of national and state-based population and administrative data sets in the US and in many other countries as well. So I personally feel very pleased about that, because criticism often comes that this is a special group and they need something special. There's this whole field around providing specialist support to people with intellectual disability. And I've always argued that it's the person first, and then it's thinking about their environment, their context, and then what would be supportive to them. And yes, in some instances, it may need to be specialized support, but in many instances, the support can be provided in a very natural and local way. And I'm reminded here, Marjorie, of a woman who I met in Canada, actually, at a place, the name which escapes me, but outside Toronto. And it was the first conference. So it was run by people with intellectual disability, for people with intellectual disability. There are over 2,000 people there. I went along as an assistant to two parents who I knew very well by that stage, a mum and dad, who had at that time two and much later a third child, and were managing with supports from family and friends and neighbourhood. And I met a young woman, a Canadian, and she had this beautiful little child, and she got up and talked. And she told the story of how this beautiful little child was her 5th child, but the only child who lived with her, the only child. So it was a very moving story. And afterwards, I chatted to her over coffee and to her partner. And she talked to me about what she thought made the difference. That when this little baby was born, and even before the baby was born, there was a neighbour, an older woman who lived 2 doors down from her. And she had taken an interest in her. And when the baby was born, the baby wasn't removed like her other children had been removed, either at birth or very soon after. She was allowed to bring the baby home. And that woman, she never moved into the house, nothing like that. But she provided the support from 2 doors down that meant that this woman with this child was able to be the mother that she wanted to be. So again, it comes down to context. And if we don't understand this and understand that parents, mothers with intellectual disability typically are more likely to have a less supportive context, then we automatically assume what we see in what they do or don't do, that it's their problem, their fault, rather than the environment has created a particular milieu in which it's almost impossible to do otherwise. So we need to start thinking about how do we change these societal, cultural, physical, financial factors which make the lives of parents with intellectual disability often so challenging.
It's again sort of fascinating to me how one story could just move you to tears. That story about this young woman that you were talking about and her 5th child. I've seen many of those moms in my career as a psychologist, but every time it moves me because I feel like the system has failed them. And what I find beautiful in all of those stories that you're bringing forward is that, in a way, and maybe I'm putting words into your mouth, but the way I was listening to you, um, it's an advocate that became someone who used academia to be able to give voice to these parents. And to me, that's what you are basically. And you've used, research and different methodology, and the beautiful talent that you have of telling stories to basically move things forward, not so much for a career, not so much for, colleagues of yours, but for those parents and their children, for those families to be together. And for that, I thank you for inspiring me yet again, and for doing everything that you do. That's pretty beautiful. Um, it will lead us to what comes next, or what should we do? Because I also retain something about your ability to see things differently. And I will retain that for myself. And I will make sure that next time I plan for something, I'll think of how to think differently. Where should the research, where should our field as a whole go, in your opinion?
It's a very big question. I mean, predicting the future is probably a fool's game. But there are several themes, I think, that are important here. They're a little random, and I'm sure people will take from them what they will. The first is, and it goes back to the beginning of our conversation, quite clearly in my mind as you were sitting in that restaurant or that little cafe, not wanting to speak, overwhelmed, and then for a long time still using a title to talk to me rather than to talk to me, the person. My first point is, and you said it yourself early on in this talk, the title does not make a person. And regrettably, when we talk about parents with disabilities, and particularly parents with intellectual disability, the title in other people's minds becomes the person. There's an assumption, a presumption that the person fulfills the title. And a very good friend of mine, in fact, the dad who was his assistant at that conference in Toronto all those years ago, he says, never assume, because assumptions make an ass of you and me. Never assume. So be very wary of titles. Be very wary of labels of terms. A second really important point, I think, is that where our field is at now is that we're starting to understand much better what you might call the life circumstances of mothers and fathers with intellectual disability that have literally through, and I say quite seriously, no fault of their own, the social, the financial, the physical, the cultural, the attitudinal environment has placed them in circumstances with a title that makes them other to those of us who are much more fortunate. So our job, in my view, in our field, is to get rid of that, to work on ourselves and our view that somehow they are other. And if we understand that disability is part of the human condition, that individuals who are worthy of respect because they are a fellow human being, we come to them with a very different perspective. And that perspective is about them as a person in their local context, their neighborhood, their family, all of the things that have made them who they are. Just like you and I have been talking about what has made me in the context of my career and my work in this area, we need to come to them in that context. And when we have a better understanding of that, as well as a better understanding of how you can actually break through those barriers of inequality, we are more likely to give parents with intellectual disability a better chance at life. What else do we need to know, though, to be able to do that well? Well, I think there's all sorts of things. My third theme is have friends in powerful places. It's a very important thing. I wouldn't have been able to carry out, in fact, that randomized controlled trial, as I said, the first one published in this field, except that the Director General of the department responsible at that time for aging and disability, when I took this idea to her, she said, we should do that. Why did she say that? And she found the money. Why did she say that? Because her background was as a nurse and a psychologist working in institutional care for people with intellectual disability. And she knew intuitively from that that there were people who could be good parents. How did she know that? How did she know it intuitively? And do we know this is the case empirically? Let me firstly address how she knew it intuitively. Because as a person, she approached each individual living there, no matter what their circumstances were that had brought them there, no matter how they behaved in that environment as a person in their own right, who needed to be understood as a person in their own right, not as a person living in residential care. There's a very big difference. They were individuals to her. So she understood context, she understood individuality. The second thing, is there evidence to support her intuition? Yes, there is. And it's from a very old study, a very famous study by Skeels and Dye. And what those researchers did, and they didn't do it from a perspective of, can women with intellectual disability be good mothers? They didn't start from that. But they were part of the early pioneering work on, is it possible to increase IQ by providing stimulating environments? Think of it as them as the fathers, if you like, of early intervention, early stimulation, all of the practices we now take for granted, absolutely take for granted, that children thrive in stimulating, loving, nurturing environments. Back in the late 1930s, early 1940s, that was not really understood. Not in the research literature. I'm sure it was understood in homes, but not in the research literature. And it was literally an experiment in an institution where they had babies and infants in one ward, and where the women who lived in that institution with intellectual disability, women themselves with intellectual disability, institutionalized because of their intellectual disability, each of them was assigned to one of the children in that ward. And over an 18-month period, the researchers took data on whether those children changed. Their development, of course, changed enormously. They had a nurturing, interested, loving carer. And those nurturing, interested, loving carers were institutionalized women with intellectual disability. So I'll finish there, because that to me speaks to what needs to happen in our field is the continuing growth and opening up of the minds of the researchers and the workers in the field to understanding that it's the local context, it's the environment, it's the person, it's the forces literally that are impacting on the person. When we understand that and work to change or modify or ameliorate some of those forces, then we have a chance of supporting parents with intellectual disability, and particularly mothers who are very discriminated against, to live less discriminated lives and to live fulfilling lives in our community.
Thank you so much. I have to say, every time I speak with you, every time I listen to you, I feel like a renewed sense of beauty in the world, for one. I see you as one of the most beautiful people I've ever met in my life. There are so many other personal stories that I could share about how you have influenced my life. And today it was very telling how you have influenced the lives of many. I hope that everybody who listens to this podcast feel as inspired as in awe of who you are. And I am so happy that, you know, I was a little bit part of the gift that you gave us today. And I thank you greatly for that.